There's times when we've struggled. We've continued to innovate. We've continued to reach down and find more energy and more resilience. And here we are tonight, really celebrating some significant victories. So we're really happy to have Assemblymember Phil Ting with us tonight, who was a main driver, an advocate for supporting our schools in the return to in-person learning. Assembly Bill 86 was signed by the governor just 2 weeks ago on March 5th. The bill encourages schools to offer in-person instruction to the greatest extent possible during this school year. Looking forward to talking to Assemblymember Ting about this, but the greatest extent possible makes us aware that there's still community spread and virus, and that we do have to continue to practice precautions. We can do this confidently because the evidence indicates that our safety mitigation efforts, which we call in San Mateo County the 4 pillars, are effective at interrupting the virus, especially in elementary schools where younger children are much less likely to have serious disease. Assembly Bill 86, depending on what color tier a county is in today, we're anticipating actually that tonight at 11:59, I believe San Mateo County moves into the orange tier of Governor Newsom's blueprint for a safer economy. But Assembly Bill 86 provides a total of $2 billion to California schools for reopening support and learning recovery. It incentivizes in-person instruction for those schools that can begin on April 1st. And the priority is on students who have additional learning needs, or for students in some grades, but especially our younger learners. I wanted to share a little bit of our data before we begin the conversation tonight, because San Mateo County is really actually doing quite well. Here on March 16th, we have 14 districts with some type of in-person learning occurring out of 24. 80 schools altogether so far. These are only our public schools that I'm listing here. We have quite a number of private schools open, but these are the districts that are currently operating in person. And these are the districts who have plans to launch. So we're thrilled to have Superintendent Pittman with us tonight. Bayshore Elementary will implement the beginning of their back to school plan next Monday, and Belmont Redwood Shores as well next Monday. Then we have a number of districts, many in the North County and on the coast side, who are getting their plans launched in April. So with that, I'm going to stop. And thank you again, Assemblymember Ting, for joining us. I'm really, thrilled about the hope and optimism that's sort of infiltrating our communities right now. I've said, sort of as a parallel to the vaccine, we're injected right now with some optimism and hope. But certainly Assembly Bill 86 fueled that. And I'm wondering if you have some thoughts about the process. It was quite an advocacy effort on your part and others. And so wondering what your takeaways are and your reflections as we have now those supports and funding in place to support our schools.
Well, thanks so much, Superintendent Magee, and thanks for having me on your webinar tonight, and really appreciate all the work that you're doing, as well as all the amazing work all the San Mateo County schools are doing. I think my reflection is how difficult it is to do anything in education. I mean, as an elected official, we all run as having education as one of our top 3 priorities. You can't run a campaign for the legislature without talking about education. But when you get up there, you realize that education is very regimented. It is extraordinarily detailed in terms of how many hours, how many school days, curriculum. It is very difficult to change anything in the education world. And try getting schools to open up in the middle of a pandemic. I mean, you might as well throw caution to the wind. I started on this journey. Frankly, I have two children in San Francisco Unified schools and have been, just like so many other parents, watching them zoom in and out of school every day, and just watch their interest in school wane, just see their moods change. And like so many other parents, just very concerned about really the impacts on all of our kids, TK through 12. Having said that, at the same time, we were hearing, even in the fall, from our California public health officials that there was a safe way to reopen schools. There's a safe way to bring children back. There were some districts that were open. I would say that some of them were doing it correctly, and some of them, frankly, were not. They were not following the public health guidelines. Definitely not doing what I would recommend, or I think what any of us would recommend, is the proper protocols. But having said that, going into the fall, we started realizing, hey, there actually is data that schools aren't seen as super spreader events, unlike rock concerts or other places, but that there is a way to reopen safely, following precautions, proper distancing, PPE, ventilation, again, making sure that we do it safely, but also acknowledging that there's real fear. I mean, there's fear amongst teachers, educators, staff about going back in the classroom. I had that same fear after about a 6-week hiatus. I went back to the assembly chamber to complete my job last year, and that was very difficult. It was, it's a little bit scary being in a room with over 100 people, even though we're all distanced, very large, a lot of air, but still, when you first go back, it is a challenge. And frankly, 3 of my colleagues ended up getting COVID. Not sure if they got it from being in the chambers or whether it was because they were traveling back and forth or where they got it, but 3 of my colleagues did end up contracting COVID. So again, just to set the context, we know how challenging it is, and frankly, how there is a lot of fear. And frankly, that fear comes from a lot of us working from the state, because we've been warning people how dangerous this disease is, asking people to stay at home, asking people not to come into contact with other people. And so when you're asking children and teachers to go do something else, it's very challenging. And so in December, we introduced AB 10, which was a mandate to bring schools back. We worked toward a compromise of AB 86, which was more of an incentive program. And also not just incentives to reopen schools, but also $4.6 billion for learning recovery, starting in, you could use it for summer school this year, summer school next year, the school year the following year. And it's really focused on getting districts to spend it on in-person learning. And so I think that, the challenge that we see right now is really slowly getting everybody comfortable with the idea of coming back to the classroom. That's teachers, that's students, it's parents, it's janitors, it's nurses, social workers, principals. There's a whole range of emotions. I know that you're all used to this being in the education world, but people have very strong feelings about their children and their schools. Right? There's no shortage of that. And so I think we are trying to be respectful, but at the same point, trying to send a signal that, hey, we think, especially given that that's great news that, we're going to be in orange in San Mateo, we're going to be in orange in San Francisco. Once you hit orange, the transmission level is fairly low, and it's really time to try to bring folks back. Now, I know not every community is orange, that's a county-wide number. So some communities, like I know in my community of Daly City, there's a little more challenges, a little more spread, as well as in South San Francisco. And so I think we have to be cognizant and recognize that, but I think there's still a way to bring children back in that context. And so I know there's a lot of confusion, especially from the parent community, about the Distance Learning Authority. So I just do want to clarify that the Distance Learning Authority expires at the end of June this year. There's no authority beyond June 30th to do any more distance learning. And I know that districts and superintendents are going to ask for flexibility. And I think we went into this year and gave districts and superintendents, and frankly, everyone in all the education stakeholders flexibility. And frankly, it didn't work very well. I would have thought, based on where we are in COVID numbers, there'd be a lot more schools open, just kind of following at. We saw that districts had a huge amount of challenge adapting. Obviously, most districts don't have public health officers, if any public health officers. I know they have nurses, but not public health officers. And so it is challenging, right? So I think we're looking to provide more direction from the state. That's probably my takeaway, that we're going to have to be a little bit more prescriptive going into this next school year. But I imagine, hoping, knock on wood, with all adults vaccinated going to the next school year, and I think a certain number of children potentially vaccinated by the next school year, that I anticipate that we should be able to open in-person learning. I don't know what that looks like, whether we have to substitute distancing, masks, things like that, but I would anticipate that we should be able to be back at school starting in August or September, depending on whenever your school dates are. So, and thanks so much for having me on. Really appreciate, looking forward to this discussion.
That's great. I am also looking really forward to hearing from those who've been on the ground doing the work. And before we switch over to hearing from our educators, I want to go back to, let me find my PowerPoint. I just want to show, let me see here and do this the right way. There we go. Share screen, and here we go. Just going to talk a little bit about the 4 pillars in San Mateo County. We were able to establish these 4 behaviors in our schools as the key public health messages about how we stop or slow the spread of the virus in schools. So lots of hand washing, health and hygiene. That means if you're sick, you stay home. We went through, remember, we're kind of looking back over a course of a whole year where we went through quite a challenge of can young children wear face coverings? The physical distancing has been quite a topic of discussion lately, certainly, but all the way through the pandemic, pretty much the 6 feet became the standard of care. And so schools worked on their plans around those conditions. And then while schools are gathering places for communities, we have paused those, like many other of our social gatherings. But these 4 pillars, along with incremental return to school. So we've seen school districts return their students to school 1 grade level at a time, taking a week in between. Implementing all these procedures with so many students and so many staff is one of the reasons why we want to make sure those routines are really well built into the program. And as a result, we've had very little evidence of transmission of virus in San Mateo County. So let's talk to those people who've actually been there and done that. I'm going to introduce Janet Holbrook, who's a 1st grade teacher in the Los Lomitas School District. And Janet, you're one of those districts that's been back on campus since October, which, if we trace back through all the peaks and valleys, I think was between sort of that end of summer spike and before we got to that Thanksgiving spike. And very few schools at that time had returned to in-person learning. So you didn't really have the advantage of models to follow or, anybody blazing trails for you. But what do you remember about those weeks and days just before returning to campus? Because that's where we find a lot of our educators right now, is they're getting ready to return. And I'm curious about what you were focused on during that time period and what you were feeling.
I was looking forward to seeing children, and I was looking forward to reading a story and hearing kids laugh instead of seeing their muted faces on a Zoom screen. Mm-hmm. So that's what I was feeling. And what I was doing was rethinking routines. Schools are built around routines for lunch, routines for arrival, routines in the classroom. And I need to rethink those, particularly around preventing congregating, right? In a normal classroom, I might put, math equipment or science equipment on a table and say, everybody go get 4. But that creates congregating. And so I had to rethink routines to make sure that didn't happen. I had to rethink routines to integrate all the 4 pillars. So I've got 16 kids and they all need to wash hands for 20 seconds. Somebody's going to be first and somebody's going to be last. What are the others going to do when they finish? You know, those kinds of things. What are the most efficient ways to get 16 kids to wash their hands so we can get on with learning? So that's a lot of what I was doing prior to reopening. I have to say we've come up with a lot of solutions. Some of the things that I originally thought were going to work didn't work, but that's the nature of a classroom. You rework it.
That's, you know, really great. And I think, you know, when people wonder why can't all schools open fully right this minute, if the health conditions would allow it, there's still transmission in the community. We still have to practice the 4 pillars. And teaching those young ones those routines really does take just a little bit of time. They pick it up quickly, don't you think?
Yes, they're very good about it. And I have to say, though, teachers are good at teaching routines, and that's what you have to do. I had to teach how to scrub your hands, and now they're very good at it. In fact, parents have told me their water bills are gone up because for so long. You know, we had to teach things like, if your mask breaks, you have to step outside the room. You know, if you're going to blow your nose, you have to step outside the room. But as soon as you taught all those things, they upheld the 4 pillars. We were back for maybe 3 weeks, and my first graders, somebody asked one day, will we ever have to go back to Zoom? And I said, yes, if one of us gets COVID, we have to go back to Zoom. And that's why we're doing all these precautions. And I think that helped them to commit more deeply to it because they wanted to stay in person.
Yeah. Well, one thing is that our students, we talk about learning recovery, and it used to be sort of framed as loss. But I would say our students have learned some very, very important lessons this year that will carry them through the rest of their lives. Living through a global pandemic where you have to innovate, be flexible with your schedule, watch your routines kind of reshape around you. Such an important lesson. And I'm guessing that you probably talked about that to some degree inside the classroom.
Yes, we've definitely had to talk about being flexible. We did in December go back to Zoom for a week, or a couple weeks. That was planned for around winter break. I think one of the things that we've demonstrated as a school is that your education is so important that learning isn't going to stop even in a pandemic. And whether that's on Zoom or in person, your education is important. And that's why we're all here. Great.
So one controversy that we experienced over the course of the year was, can children wear masks? And we have Dr. Patel here, who's not only really a very wonderful person and a generous pediatrician, but also I believe you are the president of the San Mateo or the Northern California chapter of the American Academy of Pediatricians. Am I right about that, or pediatrics?
Yeah, I mean, I'm not quite called a president, but I am the member at large for this region.
Okay, great. And so you were an early advocate, one of those people sending lots of emails around about, masking. And can you talk a little bit about, your reflections of what we've learned about young children and wearing masks, and what your experience has been in trying to sort of advocate for that behavior?
Yeah, sure. First of all, thank you for having me. And also I want to really thank Janet, Ms. Holbrook, for your trailblazing effort, because I know you've been doing this for a while, and we really rely on your experience to help move us forward. In terms of masking, yeah, so there is a lot. I was just thinking about this because as we reflect on the year, that there was a lot that we didn't know about masks when we first, it's hard to think that once upon a time, none of us wore masks, and including children. I would say in terms of the reflection, a couple things. Right over time, we learned of the power of masks and the ability for it to really keep us protected. And then in terms of children, I will say that we learned over time about how young we could go, and sort of found that the younger we went, the more accommodating and able children were. At the moment, we're at the age 2 and older. And the first thing that comes to mind is just like schools and grocery stores and that sort of stuff. You know, we shut down last year in March, but soon we wanted kids to come to the doctor. And sometimes kids had to come to, of course, you can't entirely shut down. And we found these children coming into our clinics and into the examination room, really wearing the masks and doing a terrific job. And that was the first learning that I had as a pediatrician, that my patients were wearing masks without difficulty, and the parents were reporting that. And then it was all the things that we know about kids. And for those of us that are parents or have children in our lives, we know that they look to us as role models, and they do things the way we coach them and really help them. And when we legitimize and normalize it, and even to some extent explain to the youngest kids about how it's protecting them, they tend to wear the masks, I will venture, much better than adults. So that's what we have found. They've been very sweet and thoughtful in the way that they wear masks, and we've had fun decorating them, or talking to parents about what kind of masks the kids are into. And they have done it really. And so, and that is the happy story about wearing masks. And we really believe that children can and would and do. There are, of course, different situations and scenarios where it could be a little bit of a challenge. Children with special needs comes to mind, children with communication delays. And it's still, not clear to us that the power of the mask is so strong that we want even those kids to wear masks, but it's not always simple. And that's where you need to engage your educators and your pediatricians to see if it's appropriate not to wear a mask. The story goes on, but I think in general, we all want our children to wear masks, and particularly while we have the option for distance learning, then maybe that's a case where then it's a better fit to stay in distance. But that's my experience with masks, that the kids do it, and they have been actually more an inspiration to the adults.
Thank you so much for that. Gonna go back to you, Janet, about, now that you're however many months in, right, into your school year, you've been in person, you've experienced all the spikes of the holidays, the travel guidance. And I wonder what message you would have for your teaching colleagues as they are preparing to go back in the next month or two here with the support of our legislators and the funding that's helping fuel all that effort.
So looking back, I think one of the things that was important that I did early on, the week before we were coming back, I sent my parent group an email, and I told them how excited I was to come back, but my goal wasn't to return. My goal was to stay. And in order to stay, it was going to take everyone in our class community, parents, children, making good decisions. I said, your kid's been at home, and now your bubble, the child's bubble is increased to 15 other kids, the teacher, a yard supervisor, and that's about 18 people, which means you need to pull back in other areas. If you're going to travel, you need to alert me. I'll work with you on a quarantine plan. And a number of parents have said to me, we realized from that letter you sent that we don't want to be the family that causes the whole class to quarantine. And I have to say, they've been really good. I will hear from a parent, oh, she woke up with a runny nose. We think it's allergies, but we're going to get a COVID test before we send her to school. Or I got an email, yesterday, we have to travel. My father's sick, so we need a quarantine plan. And I think that has helped to keep us safe. Is the principals have put out the message, I put out the message, and our families are abiding by the 4 pillars of the social contract. And that's helping us to stay in person. We've had 0 spread of COVID on our campus.
Yeah, that's congratulations. And even though you've been in person, boy, it has been quite a year for our educators. And so thank you for all that you've done this year and all your leadership on your campus and now across the county. I know so many people are wondering, what the future looks like. Assemblymember Ting, you're, really looking ahead at being in person in the fall. What we don't know, those things that we don't know, are what is going to happen with the virus. We're getting more folks vaccinated. We're going to continue to practice the safeguards. Dr. Chan, I'm wondering, about the masking piece of it. As people get vaccinated, they may want to throw off all the security and I want to be free. And what does that mean? What is the behavior you're really looking for in public health, even if we're vaccinated, but we're moving around in the community as far as masking goes?
Yeah, I think as Ms. Holbrook was emphasizing, this is part of the social contract that we have in our schools, across families and our communities. And, I think there's, amongst the 250, 300 people who are families who are participating tonight. I think some of us will be interested in masking and more restrictions, and some of us are looking forward to the day in which we have less restrictions, both in our communities and our social interactions with family members and friends, in our after-school sports activities, and within our classrooms. And I think just want to let you know that the state public health department and the local public health department are working together. We're very aware of the data and the research that's coming out. We're working with our community physicians and healthcare providers as well too. So, and one big aspect for schools though, is that we're realizing how important of one of the 4 pillars is masking. By wearing a mask consistently, we'll be able to ease some of the restrictions in other areas, whether it's towards the end of the school year or for next year. So we're considering things like, although the CDC and the state is still emphasizing 6-foot distance, we're very aware of the literature that supports 4-foot distance and 3-foot distance. And that means more people returning back into the classrooms. That might mean that we don't need to be in a hybrid half a classroom scenario for next year. But that is going to mean that people still probably will need to wear masks as long as there's variants out there, circulating virus, even in the orange level and even in the yellow level. Because so that's in context of this post-vaccination world, is as what Nancy was saying, or Superintendent Magee was saying, we're thinking about 2 things. One is the virus, and the next phases will really be who in our school community is protected because of this very effective vaccine. And I think right now we're really in this first phase right now. And we're having our older adults, and for many families, this means our grandparents, primarily our grandparents who've been immunized, and some other adults who are parents as well too. And so, and I think the next phase that we just started yesterday is immunizing parents who are below the age of 64 with disabilities and those with chronic conditions. And they're starting to get vaccinated. So that's why it's really, really important for these next 2 months, as those adults who are most at risk for the vaccine, for the virus, for all of us who are returning to school and all the children, that there continues to be very, very low transmission. And that can be achieved by wearing a mask. And I'll just finally say, I said the first stage, the second stage is those with high-risk medical conditions. And we'll be able to sync this up and march this out and think about how does this coincide with the school year. And then, probably, by the fall, we would expect that all adults with high-risk exposures will have been immunized, and most adults will have been immunized as well too. So we'll be in a place where hopefully virus transmissions can be very low, and nearly 100% of the adults will be fully protected from hospitalizations and serious illness because of this virus. So we're really aware of that, and we're starting to plan towards that. And we're going to look to work with, UCSF, Stanford, and community pediatricians like Dr. Patel to really make sure that children with high-risk conditions and all children in general are protected as well too. So those are the kind of the 5 phases we're thinking about.
And that feels very hopeful. We're sticking with the optimistic view tonight. I know I've received many communications from parents who are frustrated about the situation where you can go to a restaurant, you can have a meal, or you can go to I'm not sure which color you get to go to a bar anymore because I haven't been to one for so long, but these sort of social interactions, I think orange means you can go to a movie theater, bowling alley, these kinds of things. And then people are frustrated that school is limited. And so I've learned a lot about virus transmission in my year. And one thing I remember from, the fall is the idea that it's about proximity, how close you are to people, and time, how much time you are close to them. And so in a school setting, you've got 15 bodies, 15 kids and a teacher and maybe an aide, all in a defined space for a number of hours. So it's that proximity and time, I think, that distinguishes why a school is much more, has to be much more cautious than a restaurant or a Costco, for instance, where people are just coming and going and you're not really sitting in space with them for a long period of time. But all this medical information, I'm going to point the highlights now over to Phoebe Reed-Chambers, who's our school nurse on the call. And Assemblymember Ting, it's amazing how we at the county office have benefited from having a school nurse work in the superintendent's office this year. They have been invaluable in the amount of training and advice and guidance that they provided. Phoebe Reed-Chambers is a nurse in the Redwood City Elementary School District, which is a community that was experiencing high levels of community spread within your neighborhoods, and you started bringing students back.
Yes.
Yeah. So, it takes all of us together, this better together idea, to do this safely. And I think you probably experienced as a school nurse what that collaboration looked like around the county. So what did that look like for you?
Yes, absolutely. Love having Jill in San Mateo County Office of Education. So that collaboration for us, it's SMCOE, along with the Public Health Department, Sequoia Healthcare District, and the College of San Mateo, all, Redwood City have collaborated with all those entities to help us, and keep in that 4 pillar. It's just been wonderful to have Jill. She's collaborated, have meetings for us like monthly, that keeps us up to date on guidelines. As things change rapidly. And it's just been really helpful. She keeps us up to date on the pandemic recovery framework. And Jeannie Chevrolet, the public health nurse, we call her all the time, just to whenever we come up on a situation that we'll need some guidance on. And then we have the Sequoia Healthcare District, who's, collaborated with the nurses and also have a monthly meeting for the nurses. And they've provided additional PPEs for the nurses. which include N95 mask as well as N95 mask fitting. That was super important to us. And College of San Mateo, we've collaborated with their nursing department to have some nursing students on campus assist the district nurses with the rapid antigen testing, which is pilot program that we're doing right now. We're also doing curative. And so it's just been super helpful to be able to collaborate with all these partners to help us to maintain that 4 pillars in our school district. And like you said, we've been open partially since November. And so having all these community partners that we work with has been super helpful.
Great, thank you. So Assemblymember Ting, keep those school nurses in mind when you're creating your next budget bill around
Absolutely.
schools.
You know, Superintendent, you have full authority to keep the nurses. We just give you the money and you get to figure out what to do with it. as you know.
That sounds great. So so I do, Assemblymember Ting, want to tap on to the conversation around student testing, because I think that was a kind of a tough point to get around with passing the legislation. I'm curious what you learned about what was happening across schools around testing of students. We pretty much nailed testing staff. And I'm going to throw this back over to Phoebe in a minute, just because San Mateo County is one of 3 counties in the state of California that's doing a rapid result antigen test. That's like a little card, and you get the results in 15 minutes. And so I'm anxious to hear from Phoebe about that. But before that, Assemblymember Ting, anything you know on the horizon about, you know, this idea of testing students for COVID as we move forward into the future?
Well, I think as we move forward, there's still going to be some testing, but again, based on, I defer to, you know, Dr. Chan, Dr. Patel, really about what the right protocol is. This whole time, what we've been doing is really listening to our public health officers, hearing what the data shows us, what the science shows us, and really following that. Based on everything that I've read, I've seen, there haven't been recommendations from the CDC or from our public health department, and I don't think from the county public health department, saying that testing students is a requirement, the way that masking, distancing, other issues are requirements. And so that's who I continue to listen to. You know, I have a lot of opinions. I don't really think any of mine should really be listened to in terms of how we approach a public health issue within a pandemic. I refer those to the professionals, and we try to follow their advice. And that advice changes as Dr. Patel mentioned, we've learned so much more about this virus over the last year. So again, you know, a year ago, you know, I can remember talking to people a year ago about wearing masks and having to convince people to wear masks. That was the first hurdle. Then it was, let's make sure 6 feet apart, right? And then it was all of a sudden, you know, more proper PPE. Mm-hmm. Then it was testing. Now it's vaccination. So I think as my sense is, again, as more and more adults get vaccinated, in the sense is, you know, by the time we hit the summer, knock on wood, you know, hopefully all the adults in this country will get vaccinated. You know, you're really going to need less of a testing cadence in the school environment. Again, we're going to listen to what, you know, the county public health. You should be following what county public health says and state public health. But that's sort of what they've been saying. They've been saying, or really, you know, haven't given us guidance on.
Yeah, and it's really fascinating, this antigen test. So we have 3 school districts in San Mateo County, Redwood City, Ravenswood, and La Honda Pescadero, all a part of this state pilot with the antigen rapid results. So Phoebe, how's that been going, and what have you been learning about that?
It's been going really well. And what I've learned is that COVID testing really increases the teachers and the parents' confidence in sending their students to school, and also for teachers returning. And so the rapid antigen testing, it's a COVID screening test used to quickly identify asymptomatic people. And so with the test, it's to detect like the protein and the SARS-CoV-2 virus. And so it's self-administered nasal swab. It's a shallow nasal swab, and the swab is inserted in the nostrils 15 seconds for each nostril. So it's pretty much turning it slowly 5 times. Once that's done, we have a little card. It's called a Binax card, and we drop the reagents, insert the swab, mix it in. So we just have to swirl it 3 times, and the test result is ready in 15 minutes. 1 line would indicate that it's negative, 2 lines positive. And so if there's a positive result, then we'll do a follow-up with a PCR testing. We haven't had that so far, thank goodness. The test results are then uploaded to a database, and individuals like parents and staff, they're notified of their results and like via text or email within an hour. And so for us, we're hoping to be able to catch any, teachers or students who are positive, and especially for teachers, before they get into the classroom. And so, so we do the testing we have 2 sites that the program is being piloted, and it's twice a week for both student and staff.
So do the kids really recognize, I mean, these are young kids, right, that are self-swabbing themselves. How young are the kids that are doing this?
Kindergarten through 5th grade.
So there you go, is another lifelong skill, right? How to self-administer your COVID test, which I imagine would be something that airlines may go to for travel or concert, when we want to go out and be social. Dr. Patel?
Yeah, I just wanted to, sometimes I've heard this from families where they get concerned about the PCR test versus the antigen test. And I just really want to say, and Dr. Chan, please chime in if you feel differently, that the antigen test is a very appropriate test when you're trying to screen large populations, and that it really is effective tool, and that parents shouldn't be should not be doubting of that method. Great.
And so also really effective in schools, right? Because you're just catching not everything, but then you're also practicing the 4 pillars. So all these layered approaches are helping us get our kids back to school. So I'm going to move over to somebody who's getting her whole school community ready to get back, right? This is Audra. Curtis.
No, I just want to show people that this is the card, what it looks like.
Oh, okay.
And you just basically put a little swab right here, and you put 6 drops in there. So it's relatively easy to use, but it's not easy to implement within a whole school district and within a whole county. So I just want to express, it's not required by the state. So just want to express my gratitude to Nurse Phoebe, Redwood City School District, the other 2 school districts who were, really the first among the whole state to do this as a pilot test for, it's not research, but it's a pilot test helping California Department of Public Health go through these kinks. Because as Assemblymember Ting was saying, to me, this might be the overall approach for the fall, but for school districts to be able to go through the kinks and the logistics now that protects students and families better and gets us as a community better prepared in August, puts us in a much better position. I know it was a lot of work for Superintendent Magee and her staff. I know it's a lot of work for the staff within schools, but thank you again for doing this for your communities, for your families. By doing that additional layer of testing, it allows us to ease more restrictions sooner. So thank you again.
Great, thank you. And just for the audience, the antigen tests are not available widely across California in schools. There's schools, 3 districts in Los Angeles County and 3 districts in Fresno and 3 districts in San Mateo that are conducting this pilot. One of the things we need to learn in the pilot is how does it logistically work on the ground with real kids and parents in a real school setting? And it's not necessarily an easy lift. I think, Phoebe, you would agree that, I think one of our districts has learned that if you test the kids at the end of the day, you can test them and then send them home. You don't have to hold them for the 15 minutes. And then you have results that you can follow up overnight or before the next day. So there's all these just little things that make logistics, make the school run smoothly. And we're looking forward to learning more about that. I do believe that State Superintendent Tony Thurmond had a meeting last week sharing out already some information. And I think we might be just around the corner of having it available to more districts. So it's very exciting. So I want to get to you, Superintendent Pittman. So exciting. You guys are launching your return to in-person learning plan on Monday. But in the Bayshore School District, you have been working around the clock since the beginning of the pandemic to serve your community as a community center. And I'm really interested to hear all that you did while your students were in distance learning, but still bringing the community in and still supporting their needs.
Thank you. As everyone knows, when you start to work at a school, no matter what your position, you sign on to be a disaster service worker, and it's a requirement. And we didn't sign up and think that the pandemic was going to happen, but when we chose to work at a school, we knew that there was a chance something could happen. But there's also the calling that comes for working at a school. And while I firmly believe, and all of my staff and community know, that I believe Bayshore is one of the most special communities, not only in San Mateo County, but in the state and across the nation. In this particular instance, we're not necessarily special. Not only did we step up, all of my colleagues in San Mateo County stepped up, districts across the state of California stepped up, and districts across our nation stepped up to truly be that community school that each of our communities needed. As Superintendent Magee said at the beginning of this, we are better together. I appreciated how she said that human spirit brought us together to look out for each other. And because of that, the Bayshore School really used this pandemic as an opportunity to springboard into the community school that we've wanted to be. So what does that mean for us? It meant that we were able to partner with the Boys and Girls Club, with the Daly City Parks and Rec, and with the Food Harvest, Second Harvest Food Distribution, to provide weekly food distribution for the Bayshore community. It's not just for our kids and our families, but it's for the larger Bayshore community. So every Wednesday, we have over 400 families that either walk up or drive through our school parking lot to pick up food distribution. We were able to set up wellness coordinators. Every single staff member, including myself, have a list of anywhere from 3 to 5 children that we reach out to on a weekly or bi-weekly basis to check in with our families to find out what are the needs that they have. We've been able to connect them through organizations such as Faith in Action to attorneys, whether they were having issues with paying rent because they had lost their job, or they needed food, or they tested positive for COVID and the whole house was isolated and quarantined. We were able to go and deliver food to their house. We were able to set up a home visit team this year by applying for a grant. So we have volunteers from our staff who check in on our families. Our wellness coordinators reach out to our home visit team and say, this particular family has this particular need, and they're able to go and check on them. It could be something that the family has articulated. It could be that because of distance learning and the lack of broadband support or the mixed use of hotspots that we're able to provide, their Zoom calls are falling in and out, even though they're on their Zoom call. So we want to check in with them. There might be 3 kids in the house at the same time, all on the same hotspot or on 3 hotspots. And so we want to make sure that we're able to connect and support the family in that way. We have been very fortunate to partner with San Mateo County to offer community testing on our campus. So now every Friday we have Curative come to our school, and they offer free testing for the entire Bayshore community, as well as we transition into having our hybrid back on campus, all of our families will have the opportunity to have their kids tested every Friday. We were just connected with the larger organizations for Pacific Islanders within San Mateo County to reach out, because that was a group of San Mateo County residents who weren't necessarily being reached in terms of testing. And so now they are co-sponsoring every other Saturday testing on our campus to reach the Pacific Islanders, Samoan, et cetera, communities. So I really try to find the silver lining in just about everything. And the pandemic has brought the silver lining to us, just as I said, for us to be that community school. So I really think that it has brought our community together. And then one other plug that I want to give is, I don't know if he's watching, but we have, due to this, we were able to have now what we call Bayshore TV. So we do our Bayshore Family Circle on YouTube every morning. So our families are able to see, we do a mindful minute, we check in with all of our families. I shared with Superintendent Magee, we had our Bayshore TV crew, which included 5 5th grade students, created a 4 pillars video, which we have pushed out to the city of Daly City. I'm going to share it again. If you haven't seen it, it is fantastic. So yes, it really is a community center that is bringing all of us together, whether you have students at Bayshore or not.
That's just amazing. And I think your Dr. Patel shares this in common with you, that his son, 6th grader, I believe, is that right? Also made his own 4 pillars video.
That's fantastic.
Yeah. So, so Audra, as you look ahead to bringing students back and recognizing that they have had interrupted learning this year, what are you planning to do in folding them back in, helping them be successful, reconnecting them to in-person learning and catching them up on their skills?
So there's a couple things that we are looking at. You know, we're reaching out to our families and our staff members right now to think about what this is going to look like for the remainder of this school year as we transition into summer and as we transition into the 21-22 school year. I do want to thank Assemblymember Ting and his colleagues for the $4.6 billion that is going to be funneled through schools. Last year, prior to the pandemic, we were having conversations about how we can actually put together a solid, well-rounded summer program, and then the pandemic hit. And so there's that silver lining again. This is an opportunity for us to now actually create that environment. And so we are in the planning stages, twofold. One is, as we can think about bringing kids back, due to the physical spacing requirements, and what our school district looks like, we are unable to have 100% of our kids back on our campus 100% of the time right now. So we're doing a hybrid model. So what that means is that all of our kids will have in-person or online synchronous learning for half of the time, and then asynchronous learning for the other half of the time. And some of our families, that works. You know, one of the things that I appreciate about this is parent choice. We have surveyed our families multiple times throughout this school year, and we have just over half of our families want to stay in distance learning for a variety of reasons. It could be because they want to wait until children have an opportunity to be vaccinated. It could be that their children are thriving in this environment for whatever reason. And so we're able to provide that for them. And so during the remainder of this year, kids that are struggling in this model, we were able to also apply for a Learning Hub grant. So thank you, Superintendent Magee, for funneling that application, so that we can do extra support for our students who do need that gap bridged. As I said, we are planning on offering summer school this summer, which will be a combination of not only filling the gap and accelerating the learning that possibly was missed, but also providing enrichment opportunities for our kids. We want to be able to remind them that learning is fun. Human nature naturally is to enjoy the learning environment. And so we want to be able to provide that for them this summer. And then think about for those kids, how we can provide extra support over the next school year. And we wouldn't be able to do all of that without this additional funding for learning recovery. So we do absolutely appreciate that.
I think it's going to be a huge benefit to all students in California, the extended learning opportunities. So I echo your thanks, Superintendent Pittman, to Assemblymember Ting. I'm going to shift for the last part of the program just to the future, looking ahead. Lots of concern and anxiety and angst about what school looks like going forward. Yes, this is an optimistic moment. Like, things are getting better. People are getting vaccinated. We still need to be cautious, and we still need to practice the 4 pillars, but our health partners have updated our health guidance all along as the research and the studies have come in. So we expect that looking ahead, school is going to look a lot more robust next year. And keeping that in mind, as we look to the future, we've learned a lot of lessons, and we've been sort of forced into immediate innovation by, going straight from, what we knew as traditional school into distance learning overnight. And I think we've learned a lot. And I'm really very interested in how we're going to take those best practices that we've sort of eked out of this hard time and still keep them going forward. I don't like to say that we're going back to school. I like to say that we're going forward to school, into a new future where we're actually serving our kids and families in more effective ways. So can we, I'd like each of us to take just a couple of minutes to kind of reflect on what is that one thing that you hope we can carry forward into the future and hang on to. And I'm going to circle back to you, Assemblymember Ting, at the very end of everybody's ideas, so we can talk about what school looks like in America for the future, as a result of all we've learned from this pandemic. So I can ask for volunteers. Does somebody have something top of mind that, they said we've learned this and we should really hang on to this going forward? Give you some good teacher wait time.
I'll go ahead and start.
Great.
Yeah, I mean, I think that as Superintendent Magee, as you've said, we are still just starting to turn the corner, perhaps. But the one thing that I will think of is, we're in the business of seeing sick children, and hopefully usually healthy children, but still getting very sick in the winter. And one thing that to answer your question, I hope that we see is, I think we've all gained a much deeper understanding about how viruses work and how infections work. And I have kids too, have sent our kids sick to school. And I would think that as we go forward, that we will be more mindful of each other, and really respect infections and the virus, and protect others when we are sick.
Excellent. Thank you so much.
So I just want to piggyback on that one. Thanks, Dr. Patel. As a school nurse, yes, we see lots of students being sent to school sick. And so funnily, this year, I haven't had any sick students in the office because we're all practicing, high health and hygiene and wearing our mask, right? So I definitely would appreciate that. But also, I think for me, even though we can experience Zoom fatigue, just being able to meet and collaborate, via Zoom has made connecting so much easier for us, and so I think just being able to connect with, staff, administrators, it has definitely helped to strengthen the relationships amongst the staff, and just, and between districts, between departments, and even between our, like SMCOE, and, just being able to meet on a whim, it's just made connecting with people so much easier. And so I'm loving Zoom. So
I think that's the first time I've heard that in a whole year.
I would like to echo both Dr. Patel and what Ms. Reed-Chambers said, in that, as I'm sure Ms. Holbrook can attest to this, most teachers refuse to call in sick because it's easier to come to work and push through than it is to write a sub plan and then to think about what's going to happen when you come back. And so I do think, to Dr. Patel's point, that not only for the children, but I think that we as adults, this has provided us an opportunity for us to recognize that that we're in this together. And by staying home and taking care of ourselves, we're also taking care of each other. And I think that that's a different message that we haven't necessarily conveyed, that we truly are in this together, and we truly do want to support each other, both in health, physical and mental. And I'm hoping that we can continue to carry that forward. I also think, in terms of from the Zoom perspective, that we've recognized, to Ms. Reed-Chambers' point, that we, again, are not in this alone. As a superintendent in a county with 23 different school districts, including Superintendent Magee, we have really learned to reach out to each other, ask for help, ask for support. None of us are doing this by ourselves. None of us went to school, and I certainly, in my doctorate program, there was not a pandemic 101 class. And so this is really something that we have really learned to lean on each other and recognize that even though we have very diverse communities, we can still adjust and implement things differently and yet learn and support each other in this environment. And I'm hoping that we continue to support each other as we move forward.
Very well said. Thank you. Ms. Holbrook, anything to add as far as what you want to see carry forward?
Yes, two things came to mind. Like Dr. Patel, I think this has been the healthiest class I've ever taught in many regards. The box of Kleenex I put out in October is still sitting there because nobody's given a cold to the whole class, because it just hasn't happened with the masks and staying home. But educationally, the thing that I would think about going forward is I teach outside about once a day, and I did it originally because the classroom would get too loud, right? Because we're socially distanced and things like rugs have been removed from the room. But there are some benefits to being out there and being able to be in the fresh air and sit by other people and work in a different group. And so I think I would probably, as a teacher, continue to think about teaching outside even after the pandemic.
And that's a whole new strain of professional development we have, is outdoor classrooms and all that we can do and when we're, here in California, what a great environment to take advantage of, right? So that's really quite beautiful. Thank you. Dr. Chan, do you have anything to add?
I really appreciate listening to you all just describe all the love and care and flexibility that you've all needed to make for your families during this really difficult year. And, I think, there's many questions about are the public health officers aware of the research, such as like 3 feet. And, we typically see that research as preprints or before they're published, and we like roundly discuss them ad nauseum. And but we do appreciate the questions. We appreciate that parents are asking these great questions, and we appreciate the advocacy of you're trying to do the best for your community. one thing is that, this, I mean, just a small part of my job is just to think about schools, but school reopening is maybe the most complex issue that we're facing in the pandemic. So anybody who yells in one direction that it's so clear and simple to open everything up or close everything down isn't understanding all the nuances and doesn't. And trying to balance this does require a lot of humility and requires balancing a lot of the science of both the risk of COVID as well as the risk of social emotional well-being and learning for children. And another aspect it does is it really requires understanding that workers and families are at different levels of risk. And, though my wife and I might be vaccinated, we recognize that other parents might have a severe illness and severe medical condition. They might need to go to work and they can't do distance learning. And that requires humility. It requires caring about your neighbor, protecting each other. It involves understanding privilege, structural inequities, racism. So I know that many of these families, and we in San Mateo County, we do understand those things, and it's really difficult to hold those things in our heart in this difficult pandemic. But so I do really appreciate everybody that does, continues to be kind to each other, continues to protect your neighbor. I mean, we're going to continue to need this towards this end of this flexibility, towards these last 8 weeks of the school year. And we're going to really need to be working together to set up a really good school year in 2021 and 2022. It's going to be, to me, I think it's going to look a lot more like normal school than it did this year, a lot more like normal school. So we do need to work really hard in order and have a lot of understanding for each other in order for that to happen. So thanks again for everybody for all these great comments today.
Thank you, Dr. Chan. I know that in San Mateo County, where we do have 23 districts and our local communities are really quite different from each other. It's been confusing and perplexing about why one school district seems to be able to open and another does not. And it really doesn't have, it's really much more simple than it might appear, that our communities of color have been much more impacted by COVID-19, both in contracting disease and experiencing serious illness and death. And that has been true in San Mateo County as well. And communities where there are, whether it's more housing that supports more multi-generational families living together, there's older grandparents in the home or multiple families living in shared spaces, also raises the risk. And so one thing that's been really powerful, and I think this is important that I'm happy to share with you, Assembly Member, is the power of local control. Because our elected school board members, they represent those local communities, and they hear from their residents and their neighbors. They don't only hear from the people wanting to get open as quickly as possible, but also from those people who do have older grandparents in the home, or someone with underlying health conditions, or great fears for good reason around the virus. So our local school boards and superintendents have done a hero's job of trying to hear the community and trying to find a middle path to get back to school. And I want to say that the optimistic thing is that it's happening now. I've always said all along, one kid on a school campus is a victory. One kid on a school campus for an hour is a victory. And we have to see it that way, because it's been such a monumental and complex landscape to navigate. But everyone has been dedicated to this purpose all along. So here we are, 14 districts who have some in-person learning going on, 4 more looking, or 5 more coming on back on track here in the next few weeks. I know that the state, California Department of Public Health is working on guidance for graduation. And we will be following the California Department of Public Health guidance around those celebrations at the end of the school year. We've got athletes back on the fields, practicing 4 pillars out, on their football field and playing rugby, but the kids are getting back to their passions. So if we can remember our social contract, be kind, continue to be patient, follow public health directives, and trust that we will be, I feel confident that we'll be much more robustly in person in school as we go forward. So one thing I don't want to lose, though, is before we leave here, is that the idea of distance learning, hybrid learning, and in-person learning actually is an amazing opportunity to progressively educate children. And I think all 3 options have very real context and very real application for our kids going forward. I've heard from many families whose kids have actually thrived in distance learning, who may suffer from social anxiety or other kinds of, challenges, and they've thrived. And I've heard from parents whose kids are balancing jobs and also attending their hybrid learning classes. And actually, they're choosing to stay in that model. They're choosing not to go back to in-person because they like working on Tuesdays and Thursdays and going to school on the other 3 days of the week, which, of course, we know those are life skills and really important things that our kids are learning. And then we also know how important that school community is. As Superintendent Pittman, you sort of explained to us, the school is the heart of a neighborhood. And never have we felt this more in both painful ways and joyful ways over this past year. And so that's why this is so complex, is because we've gone to the heart of our communities with children, around their school, around their futures. And I'm hoping that we can, really open up the school year, consider all different kinds of times and places where we can be in school, Saturdays at night, certain days of the week or all day long, whatever it might be, distance learning, hybrid, and in person. I think it all has value. Assemblymember Ting, I'm going to hand it over to you to wrap all that up, but that's a lot of good stuff. And a lot of it is just about being compassionate communities that care about each other.
Absolutely. And I think we have to remember that in the end, we have such wonderful feelings about our school communities. For the most part, they are places where our children make friends. We as parents make friends, that they very much are our community. I think Superintendent Pittman put it, really well. Schools aren't places where children just go and learn math and English. This is really where they build community, and they are such hubs. And we see how critical they are. I know, Superintendent Pittman mentioned the food banks. They're a resource where children get food more and more. The challenge with running a school is many of society's problems, as the county has lost services or cities have lost services, it's fallen on school districts. So, if children don't have health care, well, guess what? It's on the school nurse to give them health care. If families don't get fed, well, all of a sudden the teachers and the principal needs to make sure the kids get fed with the school lunch program. So it's just a reminder how difficult running a school is. I think, having said that, it has been very, very challenging, I think, for every county superintendent, every principal, every local district superintendent to figure out how and what to do during this pandemic. And I think what we at the state have learned, there's certain things that, we're better off staying out of. I mean, we'll let you pick what day you open and what the hours are, and what color the paint should be, and where the neighborhood lines should be drawn. I think that's all really up to local districts. But I think the state has to be very directive about what opening looks like in the fall. And I think we have to work with Dr. Ghali, his department, Secretary Ghali and his department, and making sure that we really provide a lot more guidance. We heard from so many superintendents up and down the state. And I remember when I introduced AB 10 in December, it was the superintendents were also all very thankful that, like, because we're in this situation where we're just kind of stuck. We're stuck in this distance learning model. Even if we want to get out of that model, we couldn't get out of it. And so we need the state almost to come in and tell us sort of what needs to happen. And I think, going into this next budget deliberation, I think you should anticipate, that. I think that doesn't mean that we're going to get rid of local control, but I think during this pandemic, it shows why we needed a centralized response from our leadership in Washington, D.C. The same goes for Sacramento. And, when you're in a pandemic, you absolutely have to have a centralized response. And I think we're the worst for it because we didn't have a good response in DC, and we had to take up the slack in Sacramento to do the best we could. But again, we're not a nation. We can't manage our borders from Nevada, Arizona, Oregon, or other places or other countries. And so I think we really did the best we could. But I think knowing that the states, we've learned a lot in this last year, and we've known where we maybe don't need to be as direct. But I think in terms of education, I think going into next year, we're definitely going to be more prescriptive, or frankly allowing too much flexibility. I think we probably allowed a little too much flexibility in thinking that districts could really react, and districts frankly had never worked with public health departments, had really never had to deal with this kind of situation. So again, I really appreciate your work, all the educators' work, the school nurses, the teachers, the principals. My word, this has just been the janitors. This has just been the year of all years, and I'm just so thankful. We see the light at the end of the tunnel. We're starting to get vaccinated. The testing, all the things that we didn't have last March are really right there at our fingertips. And I'm so hopeful and so excited, frankly, to kind of reopen up. And I know that there's nothing more than that all of you want to do, but then just to get back to school, to see your families, to see your children, and have a certain amount of normalcy. But I just want to say a personal thank you for all the folks who educate our children every single day. And it's more than just education. Like I said, they really take care of our children every single day. I just want to say a very heartfelt thank you. I don't know a harder job in this country, in this state. It's much harder than my job, I'll tell you that. But I'm just very thankful to all of you, and just want to say thank you.
Well, thank you so much. You left me with the perfect final comment, and that is just that, one of the challenges of being an educator is that we're not public health officials. We are not medical doctors. We were put in a position to be making decisions about people's health in a very serious situation. That's why you probably heard early on in December, like, thank you, like, give us some guidance and we'll follow it, because we're not the public health officials. But to that end, the partnership with public health has been amazing and did not exist, I don't think, in too many places the way it does now between school districts and their public health departments or their county offices. And so I know for us, we are so much better off for all that we have learned and partnered with our public health officials and leaders, and people like Dr. Patel and all the other doctors from UCSF and Stanford who've come on these webinars. This is something that we absolutely must carry forward, is this critical intersection of public health and public education. it's really a shame that it took a pandemic to like shine a bright light on that, but let's keep it going, guys. I want to just thank you, Assemblymember Ting. I want to thank you, Ms. Holbrook, Ms. Reed Chambers, Dr. Patel, Dr. Chan, Superintendent Pittman, and then also to our Spanish interpreter, Teresa Mendeville, to Patricia Love, our meeting facilitator, and to all of those people who tuned in tonight to listen to this hopefully optimistic conversation. We're in this together, community contract. We can make school successful and safe for all our kids by following the 4 pillars and staying tuned in to our public health guidance. So thank you all. We'll see you next time. We hope to be back in April. We don't have a date yet, but I imagine it will have a lot to do with graduations and summer school and what next year will look like. So thanks again, everybody. Really glad you could join us tonight.